I will be going over the overview of grading. We have, for this class 6971, we have 6 learning logs. That's worth 10% of the grade. I'm in Canvas under assignments. Under clinical reflections, we have 6 clinical reflections that are worth 5% of the total grade. And then we have the hospital clinical grade that's worth 85% of the grade. So we'll go back up to the learning logs. Those of you that have already been teaching, these have been enhanced. Some are the same, but I have made the instructions hopefully a little bit better to reflect transparent design that shows exactly what they have to do with some recommendations as well as an exemplar paper. As far as their instructions, those again who have been instructors for a while, please make sure you go through the instructions as some have changed. Written communication rubric is different also. It's more or less, here's the criteria and you get to rate them. So yes, it is a little bit more subjective, but I think it's better for you to go through each section and then rate them on it and determine if they've met that objective and they give them the points accordingly. There's always going to be some subjectivity, but this is more of a simple rubric to make sure they're meeting the objectives. All right, so they have that. And then we have the clinical reflections, that's worth 5% of the grade. Learning logs are done on the weeks they're not doing their clinical reflections and vice versa. So every week they should be handing something in, whether it's a learning log they chose or whether it's a clinical reflection. The instructions are in the clinical reflections. Remember, you must grade everything. And the new guidelines is to make sure that you have a grade in the gradebook for the student within a week of them uploading it, because everything needs to be for record put into Canvas, and plus it'll help calculate the total grade. If you want to get to the gradebook, another easy way is you can click on this and you go up to Speed Grader right here, and it'll take you right to the gradebook. Now, right now, there's no paper here, but when there is one, you'll see a little box up here. You can bring up the rubric and you can write some comments. Sometimes it lets you write comments in here and sometimes it does not. If it doesn't, then you can just write the comments there. You have to upload, submit the rubric as well as the assignment comments. So that needs to be done within a week of the due date of the student handing it in. I'm going to go back to assignments and show you real quick. Let's go down to the hospital clinical grade. That's worth 85%. Those of you who've been teaching in the past, this is different. We're going to put the hospital grade, you're going to have to manually enter the grade into the speed grader here, or you enter it through the grade book. That will include, and you're going to look at the course objectives regarding patient care, prep work, their DML, how they're participating, critical thinking, again, paperwork, and just professionalism overall. So you're going to look at the course objectives. So this hospital clinical grade does not include the learning logs. It does not include the weekly reflection, because that is, the others are part 10% and the others 5%. This will be manually entered. So all of those 3 will determine what their end of semester final grade is. That is what you will put in the final evaluation for the course. And that will be a separate Dropbox now. It used to be, it would be where the hospital clinical grade is, but really it's kind of confusing and it really needs to be separated out, because these are 3 separate grades that calculate into the final grade that will be entered into the final evaluation. I want to bring up the final evaluation. The midterm evaluation is used the same document as the final evaluation. And actually, I'm going to do that in a separate video.